Hey everyone, when you hear about these big government initiatives like healthcare reform, and at first you're like, okay, sounds good, hope it works out.
Yeah,
Well, this deep dive is for you. You asked us to look into Kenya's healthcare transition, specifically the shift from the National Hospital Insurance Fund, or NHIF, to this new system called SHA.
right.
And let me tell you this commentary, the transition from NHIF to SHA in Kenya, a cause for concern, dives deep into the weeds of what's really going on.
Yeah, well, it's a complicated picture. While the goal of improved healthcare for all Kenyans is something we can all get behind, the reality on the ground is that this transition has been anything but smooth.
Right. And that's what I found so fascinating about this commentary. It's easy to get caught up in the big picture, but this really highlights the human impact. It's like, imagine going to your go-to coffee shop, the one you've been hitting up for years, and bam, suddenly the menu's different, prices are through the roof, and no one even thought to give you a heads up.
Yeah,
That's what a lot of Kenyans are experiencing with their healthcare right now.
that's a spot-on analogy. The commentary highlights the experience of patients showing up for essential treatments, like dialysis, only to be blindsided with the news that their insurance is no longer valid under SHA. We're talking about people facing unexpected costs, disrupted care, and a system that seems to be failing them at a time when they're most vulnerable.
It's heartbreaking, really. And it makes you wonder, why wasn't there more communication about this transition? Why weren't patients informed about these changes beforehand?
And that's a major point. The commentary drives home the lack of transparency and communication from the government surrounding this shift has been a huge source of frustration and anxiety. Many patients were automatically transferred to SHA without their knowledge or consent, adding to the confusion and distrust in the system.
It's almost as if the powers that be thought they could just flip a switch and everyone would magically adapt overnight. But we're talking about people's lives and well-being here. And it's not just the patients who are feeling left in the dark. The commentary points out that healthcare professionals are also struggling to navigate this new system, which further exacerbates delays in treatment and adds unnecessary stress for everyone involved.
Precisely. And this lack of communication isn't just an oversight, it speaks to a deeper issue highlighted in the commentary. A top-down approach to healthcare that often fails to prioritize the patient experience. It's like um, designing a car without consulting with the people who are actually going to be driving it. Mechanics are left scrambling to figure out the new engine, drivers are left confused about the controls, and everyone's frustrated.
And to stretch that analogy even further, it's like they've built this new car without checking if the roads were even paved for it. This commentary also raises some serious concerns about whether the infrastructure is even in place to handle this massive transition.
You're hitting a crucial point. The commentary highlights the strain this transition is putting on healthcare facilities. Many weren't adequately prepared for the influx of patients moving from NHIF to SHA. It's like flipping a switch and suddenly expecting a small town clinic to handle the volume of a major city hospital overnight. Resources are already stretched thin, and the big question is whether SHA actually has the funding and the operational capacity to handle this increased demand effectively.
It really makes you think about those on-the-ground realities. The commentary mentions instances of overcrowded hospitals, patients facing even longer wait times, and essential medical equipment in short supply.
Exactly. And these infrastructure challenges further compound the feeling of being left behind that many Kenyans are experiencing. The commentary quotes one healthcare worker saying, "It's like we're being asked to build a house without bricks and mortar. We want to provide quality care, but we're lacking the basic resources to do so."
Wow, that really puts things into perspective. It's one thing to talk about policy changes, but it's another thing entirely to see how those changes are impacting people's daily lives. So, with all these challenges, where do we go from here? What can be done to get this transition back on track and ensure that Kenyans have access to the quality healthcare they deserve?
That's the million-dollar question, isn't it? The commentary emphasizes that this isn't an impossible situation, it's a critical juncture. There's still time to course correct, but it requires a concerted effort from everyone involved, especially a shift in mindset from the top-down approach to one that prioritizes the patient experience.
So what would that look like in practical terms?
Well, the commentary suggests a few key steps. First and foremost, transparency is paramount. The government needs to be upfront and honest with its citizens about the changes being made, what those changes mean for their healthcare in concrete terms, and how they plan to address the challenges that have arisen.
It's like they need to hit the pause button on autopilot and actually listen to the GPS, which in this case is the people on the ground, right?
Exactly. And that leads to the second crucial point. open communication. The commentary stresses the need for establishing direct lines of communication between the government, healthcare providers, and most importantly, the patients themselves. We're not just talking about town hall meetings once a year, but consistent, accessible channels where people can voice their concerns, get accurate information, and feel heard.
So less about dictating the terms of this transition and more about a genuine dialogue where everyone's voice is valued.
Precisely. The commentary suggests a multi-pronged approach. Public forums where people can directly engage with policymakers, dedicated hotlines to address immediate concerns, and even leveraging technology, perhaps through SMS updates or online platforms, to keep people informed in real time.
That's a great point about technology. In this day and age, there's really no reason why people shouldn't be able to easily access information about their health care, report issues, or even provide feedback through a user-friendly app.
Absolutely. Imagine a system where you could track your insurance claims, receive updates on policy changes, locate nearby healthcare providers, and even provide feedback on your experiences, all at your fingertips. Technology has the potential to bridge the communication gap significantly and empower individuals within the healthcare system.
It's about meeting people where they are and using the tools available to create a more responsive, patient-centered system.
Exactly. And that's ultimately what this all boils down to, isn't it? This transition, while rocky so far, presents a unique opportunity for Kenya to build a healthcare system that is not only more efficient, but also more equitable and, crucially, more human-centered.
It's about shifting the focus from simply providing healthcare to ensuring that healthcare is accessible, affordable, and truly serves the needs of every Kenyan citizen.
Well said. This commentary, while highlighting the challenges, ultimately offers a message of hope. By acknowledging the missteps, embracing transparency and communication, and prioritizing the patient experience, Kenya can chart a new course toward a healthier future for all.
A healthier future where access to quality healthcare is not a privilege, but a right. A huge thank you to you for lending your expertise to this crucial conversation, and to you, our listeners, for joining us on this deep dive into Kenya's healthcare transition. Remember, your voice matters in shaping the future of healthcare, not just in Kenya, but globally.